Okay, today we're going to show you how to use the new Navigator or physician support that's within CancerBot. So we're going to sign up as a physician and just give it a unique name if you haven't signed up. I'm going to sign up. It can be a unique name and a unique email. I'm going to sign up as a physician or navigator. My own identity, and I'm going to click patient navigator or doctor, and that's the sign up. So I will click on this blue button. I need to give it a unique ID. Let's try this. Need to give it something where we have, yeah, okay, great. So that email did not exist before. You'll get this to this blank screen. This is where you add patients from. And so we're gonna add Alice patient. And it just needs to be an email that's not already in the system. And okay, so now it's waiting for patient acceptance. So if I go to my email, I will click accept on the invitation in the email. I'll just give you a view of this. So here's my email client, and I just click on accept invitation, and then it prompts me to just give a password. So this is Alice patient's email. All she has to do is, we've created an account for her, she just provides a password. It's at least 8 characters, and she accepts it. Okay, and now it's going to launch her. It's launching Alice into this dialogue of onboarding of what's her disease and other statistics, okay? So Alice can do this as the patient. She can identify her disease. It's going to go and ask her a handful of questions so we can suggest trials. But you as the navigator may want to do this yourself. So let's show how that happens. So this was what happened on the sign up. And there is a bit of a small bug. We want to refresh the screen, and then this will show that the patient profile is enabled. So if you want to, it's up to you. You can have the patients where you tell the patient go on board yourself, or you as the physician or nurse navigator can do the onboarding. So let's go ahead and onboard Alice patient as a follicular lymphoma patient. And we're going to say that she is stage 1. So this is me. You can see how it says patients, patient Alice, patient. This is me as the navigator entering Alice's data that we have. Again, Alice can do this herself. So we're going to say they had 1 line of therapy and involved site radiotherapy. What was the outcome? The outcome was stable disease. And you're sort of getting a sense of why you may want to do this instead of the patient. Maybe the patient doesn't really know how to characterize what the outcome was. So we're going to identify the date. By the way, I'm giving the data that I had as a patient. And I had my involved site radiotherapy back in October. And this will, of course, work for the United Kingdom or the USA. I'm going with my information, so I'm just going to enter my United Kingdom postal code. But again, this will work for the US. And we can now view some trials. So here's some trials. We can sort it by goodness, which we've discussed in other videos. We can sort it by distance. We can see things that are close. And there are some interesting trials that are close to me. for my particular disease. This one is interesting to me, the mosunetuzumab and glofitamab. And this is right here in Edinburgh. I can go and participate, and you can see it's a rather complex trial with a bunch of requirements, and we can click on more information to register interest in the trial. What's interesting is that if the patient clicks on more information to register interest, that email goes to you. If you register information, the email will actually go to the researcher and the trial owner to try to get you onto that trial. But if the patient does it, it will go to you as the navigator or physician. So we can also, now you can always do that as long as nothing makes you ineligible. You can see there's a lot of things about this that we're eligible for it, but there are some questions that aren't answered, and you can go ahead and, as the navigator or the patient can do this, say what you know about their ECOG levels. Do they have a negative pregnancy test result? Because obviously the more information that you fill out, the more likely it is that the patient is going to actually get onto this trial, because trial owners want to have people actually match the criteria. So just in that spirit, I'm going to go ahead and enter more information about the patient, the grade of the tumor, whether or not it's refractory, and the planned therapies, let's see, and then pre-existing conditions, we can say we have none, and you can see that we're quite eligible for this rather complex trial at this point. So that is the basics. We've just done it for one patient. We can go back here. We can click on more information to get registered for the trial. We can also enter additional patients, and then they can onboard with their own information like we saw, or you can onboard and enter the information for them. So that's our physician, nurse navigator support in CancerBot. Please let us know any feedback that you have or requests at support@cancerbot.org. Thank you.